My dear students, remember this. Today is very much important topics I like to highlight all of you. This is drowning. It's very much important topics. It is one of the most important childhood mortality, morbidity all over the world, not only Bangladesh. And you know, just 3 days back in Kumilla, Chandina, 4 children died due to drowning. Just 1 week back, one body is shrinkage in Bandipura district of Kashmir in the Jhelum River. The 26 people is died due to drowning. So remember this. Drowning is one of the most important childhood mortality, morbidity all over the world, not only Bangladesh, all over the world. Remember this. First of all, I like to tell you that what is drowning. It may be defined as respiratory impairment due to submersion, immersion of any liquid media. Remember this. It may be defined as an impairment of the respiration due to submersion or immersion of the any liquid media. It may be water, it may be mercury, it may be alcohol, it may be in the gas. Remember this, not only water. Any liquid media, maybe water, maybe alcohol, maybe mercury, maybe any gas. Remember any liquid media. Remember this one. Okay. Now what are the different? First of all, early diagnosis and early severe cardiopulmonary resuscitation should be initiated early. This is the management paradigm. But this one. Now you look what is the effect? What is the effect? What is the effect of the drowning? There are 3 effects. Remember the 3 effects. Remember this. How many effects? 3 effects. Aspiration pneumonia, then hypoxemia, then hypothermia. Then and there you write in your book. There are 3 effects mainly, principal. 3 effects. Remember this one. What is? Aspiration pneumonia. Number 2, hypoxemia. Number 3, hypothermia. Remember this one. Now you look towards my slide. Look, here also I given the definition. Drowning may be defined as death within 24 hours of submersion. Your drowning is one of the another cause is survival mode. You look towards the slide. If possible you can take the picture. If possible to take the picture, okay? Near drowning means defined as survival more than 24 hours is known as near drowning. There are several types of the drowning. You saw it, I shows there. Look, I shows there. There is a dry drowning one. One is wet drowning. Dry drowning ki, wet drowning ki, you must know. I given the definition. Look there. Dry drowning means water doesn't enter into the lung parenchyma, but death results from the immediate sustained laryngeal spasm and due to inrush of water into the nasopharynx and larynx, the patient is died due to respiratory failure. This is wet drowning, dry drowning. Now comes wet drowning. Wet drowning is this type of when water is inhaled into the lung parenchyma. And immersion syndrome, another one is death result from cardiac arrest due to vagal inhibition. You show me right run there and then you write in your book, not in our outside, in your book. Remember this one. This is all the terminology I told to you. Now you see the pathophysiology. Very nice flow chart. You look. Very nice flow chart. You see what the fresh water drowning, what will happen. You look, fresh water drowning, when the water into the lung parenchyma, water gets reabsorbed by the lung capillary, then what will happen? Look what the slide. What will happen there? There will be hypervolemia with hemodilution. As a result, RBC will be swollen and hemolysis. After hemolysis of the RBC, what will happen? Potassium will be comes out, hemoglobin comes out, and bilirubin also comes out from the RBC. Then what will happen? There is three effect. That is, hemoglobin comes out. Hemoglobin comes out means, and bilirubin comes out. It called the hyperbilirubinuria. It causes acute renal tubular necrosis. And due to RBC breakdown, then what will happen there? There is hyperkalemia. So there is hyperkalemia. Hyperkalemia, hyponatremia. Then what will happen? Ventricular tachycardia, fibrillation. Look toward the slide, and cardiac arrest, patient dies. Very much important consequence. I told you to take the picture of this. Why not? Never tell like this. Nobody told like this. Pathophysiology like this. Nobody told like this. Remember this. What is the pathophysiology of the water fresh water drowning? Nobody tell like this. Remember this. Next, this is seawater drowning. What will happen in seawater drowning? What will happen? Look, when the seawater means salty water. Seawater means salty water. When salty water enters into the parenchyma, what will happen? Look. Due to high salinity of the seawater, the water is drawn from the body fluid. Then in the lung tissue, there produces a pulmonary edema, and there is a hypernatremia and hypovolemia, resulting myocardial dysfunction, acute tubular necrosis, and patient is ultimately death. This is called seawater. The flow chart, use the flow chart here. Nicely I show the flow chart. Flow chart shows. Now, what is dry drowning? Know the pathogenesis. What are the consequences of dry drowning? I told everybody to take the picture, but you people still, just your gossips. Just gossips. Nobody does not respond this. What happened in dry drowning? Look, what happened? Rapid rush of water into nasopharynx. What will happen? Larynx causes laryngeal spasm. Then what will happen? Water never pass into the lung parenchyma. Then what will happen? Development of asphyxia. Victim died due to respiratory failure. Very nice consequence like this. Next, now the clue of diagnosis. What the clue? What the clue of the diagnosis? You see, clue of the diagnosis. Look, clue of the diagnosis. Clue of the diagnosis. Look. You show this one. Clue of the diagnosis. Age. You look age. Age is 1 to 4 years. The child was not seen for some time before the accident. Next, found submerged underwater for variable time. Number 4, other family members tried locally to remove water from the body. Next, impaired consciousness. Then what will happen? The cold extremities with washerman, hand and feet. This is very much important sign. Very much important sign. Cold extremity with washerwomen, hand and feet. Then copious growth from the nostril, shallow respiration, poor air into the lung, activation of the both of the lung field is very much important. This one, remember this. This is the clue of diagnosis. Now the management. The two types of management. One is rural, local area, the rural treatment, rural area, the community level. Community level, suppose in Muradpur, Muradnagar Upazila, Balsarampur Upazila, or Gorifur Upazila, remote area, what is the treatment? Treatment in the community level. What the treatment will do? Rescue the patient from the water as soon as possible. Then what? Remove the wet cloth and wrap the victim with the warm blanket. Look toward this. Not to be. You walk towards your slide. Assess the vital sign, fast respiratory temperature, blood pressure, temperature, activity should be so remark this one. Often they are remove the visible debris present on a oropharynx nasopharynx finger with finger sweep maneuver. There are no sucker machine. There are no sucker machine in the Muradnagar. No sucker machine. So remove all the area clear by the finger cleft maneuver, finger with being finger sweep maneuver. Initial rescue breathing by there are no oxygens, mouth to mouth respiration. There are no supply oxygen. There are no oxygen available in Muradnagara, Chandina or Goripur or Borura. Tali kibabe oxygen deba? Mouth to mouth respiration. Next, it is quick transport the patient to the higher center. Higher center of the ambulance. Okay. Next, it is a hospital. This is hospital management. That is tertiary level hospital. This management is tertiary level management. What? How they give it? Look, give high flow oxygen through the nasal cannula, nasal front or face mask, around 5 to 6 liter like this. Okay. Next, respiratory supported by intubation, bag and mask ventilation with cardiac message. Remember this one. With cardiac message. Okay. Next, poor perfusion to the IV saline and regional lactate. Maintain body temperature 32 to 34 degrees Celsius by wrapping the blanket and other radiant warm body. Remember this one. Then this is pulmonary. This is called pulmonary edema. Should be treated by oxygen inhalation and diuresis. Very good. Then mental can be used for cerebral edema, seizure disorder. Should be controlled by anticonvulsant. Remember this one. Remember all this. Now, in shock or myocardial dysfunction, IV fluid and duphapine should be given. In metabolic acidosis, sudafed should be given. In bleeding tendency due to thrombocytopenia or DIC, what will given? Transfusion of platelet transfusion and fresh frozen plasma should be given. And antibiotics should be used if infection is suspected. Remember this one. Next, look, prevention is very much important. Prevention is better than cure. Remember this one. Prevention is better than cure. Remember this one. Parents counseling about natural history of the disease and its outcome. Appropriate barrier must be built around the ponds, tank, lake. Shaरीरिक দিয়ে বাড়া দেওয়া বা ওয়াল করে দেওয়া, this is all barrier should be built up. And parents should be supervise the children around the water. Next, children should be taught safe conduct around water and use life jacket during boating. Remember this. Use life jacket during boating. Now you see, now the reference देखो Nelson textbook pediatrics 21st edition, practical pediatrics problem by James Hutchison and Horace Cookburn 6th edition. Thank you very much for patient hearing. Remember